High blood pressure, also known as hypertension, is a prevalent condition impacting numerous individuals. Even without noticeable symptoms, untreated high blood pressure can result in severe health complications. There are instances where it can escalate into a hypertensive crisis, a critical medical situation necessitating immediate intervention. This presentation delves into indications and manifestations of high blood pressure that could signify danger, warranting urgent medical treatment. In this video, we will delve into cues and signs linked to high blood pressure that could serve as red flags. These indicators necessitate immediate medical attention, whether these symptoms become apparent in your personal experience or raise concerns regarding someone you care for. This manual serves as a valuable resource. It equips you to discern the cautionary signs and undertake fitting measures. Severe headaches. Severe headaches stand as a prevalent indication of elevated blood pressure and can signal a hypertensive crisis, a medical urgency demanding instant attention. These headaches usually manifest as potent and relentless, often accompanied by concurrent symptoms such as nausea, vomiting, and dizziness. The positioning of these high blood pressure-induced severe headaches is generally at the rear of the head, though sensations may also resonate in the temples or behind the eyes. The pain often exhibits a throbbing or pulsating quality, reaching such intensity that it disrupts daily functioning. It's essential to recognize that not all headaches trace back to high blood pressure, with a myriad of potential causes including tension headaches, migraines, sinus infections, among others. Nevertheless, if you're grappling with a formidable headache resistant to over-the-counter pain relief, or accompanied by other concerning symptoms like altered vision, confusion, or numbness, swift medical intervention is vital. Ignored, severe headaches spawned by high blood pressure could cascade into severe ramifications such as stroke or cerebral damage. Perplexing fatigue and cognitive haze. The ramifications of fatigue and confusion are far-reaching, potentially paralyzing a person's capability to execute daily tasks and make judgments. The fatigue resulting from elevated blood pressure might epitomize an overwhelming sense of weariness, even after adequate repose. Those ensnared by fatigue may perceive themselves as listless, feeble, or perpetually on the brink of slumber. Conversely, confusion may manifest as impaired focus, memory glitches, disorientation, or cognitive fogginess. When these symptoms emerge as a byproduct of high blood pressure, it's crucial to seek swift medical attention. This urgency arises from their potential as precursors to a hypertensive crisis, a life-endangering state if disregarded. Should these symptoms grip you, it's prudent to abstain from driving or handling heavy machinery until their subsidence. Dimmed vision. Blurry vision emerges as a frequent manifestation of high blood pressure, characterized by the erosion of visual sharpness or clarity. The affected individual might additionally grapple with focusing difficulties or the inability to discern finer details. The emergence of double vision, the perception of twin images of an object, side by side or one atop the other, further compounds the distress. In both scenarios, a swift medical response is imperative. Blurred vision and double vision potentially signify a hypertensive crisis, fraught with peril if unaddressed. Furthermore, these optical symptoms might hint at other grievous conditions such as stroke or retinal damage. Chest discomfort. Chest pain that traces its origin to high blood pressure might encompass sensations of tightness, pressure, squeezing, or a burning fervor in the chest region. This discomfort might radiate to adjacent zones such as the neck, arms, or back. Such chest pain is an indication of latent heart conditions like angina or heart attacks. In certain instances, this pain could be accompanied by ancillary symptoms like breathlessness, nausea, or lightheadedness. In the presence of chest pain, an expeditious medical evaluation is mandatory. The reason behind this urgency lies in the potential of chest pain to herald a hypertensive crisis, laden with peril if untreated. Additionally, this discomfort could gesture toward other critical situations like heart attacks or pulmonary embolisms. While chest pain can certainly be a symptom of high blood pressure, it's crucial to note that its origins are manifold, encompassing factors like anxiety, acid reflux, and muscular strain. Breathlessness. Elevated blood pressure can usher in difficulty breathing, materializing as shortness of breath or an oppressive sensation in the chest. The individuals grappling with this challenge might perceive an inability to establish a regular breathing rhythm, or might feel their breaths are shallow or labored. Wheezing or coughing might also accompany this phenomenon. In the event of high blood pressure-induced breathing difficulties, immediate medical intervention is warranted. This exigency arises from the potential of these symptoms to signal an impending hypertensive crisis, replete with life-threatening consequences if disregarded. Those ensnared by breathing difficulties should steer clear of exertive activities and prioritize ample rest. Additionally, minimizing exposure to pollutants like smoke or dust is advisable. Irregular heartbeats. An irregular heartbeat is typified by a heart rhythm that veers into excessive acceleration, deceleration, or a chaotic pattern. This could precipitate compromised blood flow and oxygen delivery to vital organs. High blood pressure-induced irregular heartbeats could spotlight underlying heart conditions like atrial fibrillation or congestive heart failure. The presence of ancillary symptoms like dizziness, lightheadedness, or chest discomfort might further underscore this irregularity. Swift medical consultation is imperative in the face of an irregular heartbeat. The rationale for this urgency lies in the potential of such heart rhythm anomalies to herald a hypertensive crisis, replete with danger if unattended. Alongside medical attention, adopting measures such as salt intake reduction, regular physical activity, and smoking cessation might be instrumental in managing high blood pressure-linked irregular heartbeats. Notably, not all irregular heartbeats are attributable to high blood pressure, with myriad alternate causes like anxiety, acid reflux, or muscle strain. Collaborating with healthcare professionals to pinpoint the root cause underpins the pursuit of appropriate remedies. Nosebleeds. Nosebleeds, medically termed epistaxis, can be a disconcerting occurrence. They often catch us off guard and can stem from a range of factors, including dry air, injury, or even simple nose picking. However, it's essential to delve deeper into the potential connection between nosebleeds and high blood pressure, particularly in cases where these episodes become frequent or seem to appear without apparent cause. Research and medical observations have hinted at a potential link between nosebleeds and elevated blood pressure levels. The exact mechanisms underlying this connection aren't entirely clear, but some theories suggest that increased blood pressure might lead to fragility in the blood vessels within the nasal passages. This could potentially make them more susceptible to rupturing and causing nosebleeds. Frequent or unexplained nosebleeds can be a signal that your body is sending a message, and it's important not to ignore it. Consulting a healthcare professional can help determine whether there is an underlying issue, such as high blood pressure, contributing to these nosebleeds. If high blood pressure is indeed identified as a factor, appropriate steps can be taken to manage and address both the blood pressure concern and the recurring nosebleeds. Conclusion. This discourse, rich in insights, serves as a compass to navigate the realm of high blood pressure's symptoms. Whether these signs intersect with your personal journey or raise concerns about the well-being of a loved one, this resource stands as a beacon. Armed with this knowledge, you are poised to recognize the crimson flags and take appropriate measures. In the realm of health, vigilance and swift action often prove to be the most valuable companions.